Welcome to this training video on interpreting an ANC visit progress report in eHAZA. In this video, we'll walk you through how to review and interpret a progress report, focusing on key sections and the insights they provide. Interpreting progress reports accurately is essential for understanding patient health trends and outcomes. These reports are a powerful tool for identifying patterns and making informed decisions. Each report includes critical metrics and data points. These metrics provide a snapshot of the patient's health journey, and these insights help identify areas where care is working and areas that require attention. Understanding patterns like this enables you to recognize improvement and address issues proactively, which ultimately leads to a better patient outcome. Involving patients and their families in this discussion not only fosters trust but also encourages active participation in their care journey. To begin, first log into eHAZA and select Patient Directory. Then enter the patient's name and select Document icon next to their name. Hi, it's Nurse Ketia again. Now that the ANC visit with Ange is complete, eHAZA generated a progress report. Let's go through this report together. The top banner shows us the patient's name, age, her estimated date of delivery, and her estimated gestational age. It also includes pregnancy history overview, her gravida and para. Para gives us a quick snapshot of what happened in her previous pregnancies. The obstetric history includes things that have happened with previous pregnancies that we want to be aware of in the current pregnancy. So she's had 1 abortion, 1 stillbirth preterm, and had preeclampsia in the past. She's also had a medical history of asthma in the past. She's had TB in the past and general depression as well. These are current diagnoses of today that can influence her current pregnancy. So she's known to be HIV and hepatitis B positive. She's been diagnosed with lower urinary tract infection, and I prescribed her medication. She was also diagnosed with mild to moderate anemia and was treated with iron and folic acid. Obstetric diagnosis in the current pregnancy shows that she was diagnosed with mild to moderate preeclampsia, and I referred her to the hospital on this date. I also performed this test, and her depression was not likely. This immunization history section tells us that 4 tetanus shots were received, including 1 today, and 1 more is required before delivery on this date. Any community-based maternal health education or follow-ups would show up here in the CHW activity section. This pregnancy timeline section gives us so much information. This line shows us the first time that we recorded fetal heartbeat and fetal movement. This right here shows us the position of the baby in the belly. This bar is for Ange to connect with her baby. Now this second section tells us how many visits she's had. It is recommended to have 8 ANC visits, including 1 in the first trimester, 2 in the second trimester, and 5 in the third trimester. Growth monitoring graphs are other trends that tell us and Ange that she's doing well and that she's growing well. This first graph tells us that Ange is in the normal range and she's growing and not losing weight. The second graph shows us that the fundal height is getting bigger throughout time and her baby is growing well. In this lab results section, if you click on lab results, you can see all the labs that we performed during the visit. When it's red, it means it's abnormal. And if you click on the arrow, you can see more details on the lab. In this section, you can see any pictures that might have been taken during the visit. With eHAZA, I'm also able to send this report via WhatsApp to her. She can then take this and discuss it at home with her family. By involving patients in this review process, we empower mothers to take an active role in their own health and pregnancy journey. Thank you for watching. You are now equipped to conduct and interpret an ANC visit using eHAZA at your health center. Enjoy!